Hi, and welcome to this short video as we are going to discuss a few of the major topics regarding putting together a diagnosis for a patient as we learn how to manage several disease processes this semester. I first want to start by thinking about how we create these differential diagnoses and what is a differential diagnosis. Creating a differential. This is a systematic process and approach that we need to take, whether we are healthcare providers or we are bedside nurses. We go through a diagnostic procedural method, and it involves several steps to ensure that a correct medical diagnosis is made. So, if you're a bedside nurse or another member of the team, getting a thorough assessment is going to help you in bringing back information to the diagnostic team to make these medical diagnoses. There are 5 key steps to this process. We need to first gather a comprehensive history. By collecting detailed information from the patient about the symptoms, medical history, family history, lifestyle factors, and other relevant data in their health record, this is going to help to narrow down the potential causes for their immediate chief complaint. And you're going to use the history of present illness with this information, putting it all into context. The next step is to perform a thorough physical examination. Once you have received a comprehensive subjective history, now's the time to conduct a thorough and complete physical exam or health assessment. This is a period where we gather objective clinical findings. Now, what makes something subjective or objective? If the information is subjective, this is what the patient is telling us. What makes it objective is if we are able to measure or appreciate the information by performing one of the physical examination techniques, such as inspection, percussion, palpation, and auscultation, and not necessarily in that order. Now, as we're gathering objective clinical findings, we're providing the team with further clues. This can reveal signs that may support, but also may rule out particular health care conditions. The third step is to now generate a list of potential diagnoses based on our objective data and the subjective data we received earlier. So, in other words, we might call this based on the history and the physical. We're going to take this data and think about all the possible conditions that could explain the underlying symptoms, the signs that the patient is sharing with us, and any other clinical manifestations that you might appreciate. Now, this list needs to then be prioritized based on the likelihood, the severity, and the urgency of the presentation. Next, the fourth step is to then think about what else needs to be done. We need to order and interpret diagnostic tests. So we're going to use laboratory tests. We're going to use imaging and other diagnostic tools to then gather even more data, but it's based on what we already are considering. And we use these diagnostic tests to help us to confirm or exclude various diagnoses to help minimize the larger list of potential issues. Now, these tests help provide objective evidence now that will further guide our decision making. And for healthcare providers, we call this the medical decision making process. And lastly, we need to refine the diagnosis through further evaluation. So when we're done with all the things that we've talked about already, we need to then reassess the list of potential diagnoses and think about it in terms of new test results and further clinical reasoning. To develop this clinical reasoning, you may need to consult with a specialist, talk with your team, or ask the patient further questions. The most likely diagnosis will then be confirmed, and the less likely or the irrelevant possibilities will be ruled out. This will bring you to the final diagnoses. These were the 5 steps that will iterate and often require revision as new information emerges throughout this diagnostic process. So it's not uncommon that you may need to go through this process multiple times before coming to a conclusive diagnosis. Thank you, and look out for the next video in a little bit.